Hi all, welcome to Easy Nurse, where nursing is made easy. So we have come with yet another topic and yet another subject, that is adult health nursing 1. Again, you feel that okay, I have to study different disease conditions right now, but we are going to make it much more easy and we will crack this exam together. Okay, let's see the first question. So the first question is acute renal failure. So what is this acute renal failure? So coming to that, it's the definition, or we'll tell it as an introduction. So acute renal failure, that is ARF, it is also known as acute kidney injury, that is AKI. So in the question paper, you might get this AKI also. So don't get confused. Acute renal failure and acute kidney injury is also the same one, and it is a rapid decline in the kidney function that is occurring over a short period of time, usually within hours and days. So within hours and days, within a short period of time, this disease condition can occur, and it is resulting in a inability of the kidney to maintain its normal fluid level will be very low. Their fluid electrolytes or their electrolyte balance will be very less, and the acid-base balance leading to building up of a waste products such as urea and creatine in the blood. So this is the main introduction or a main small gist about this acute renal failure. So coming to the next is that the definition of acute renal failure. So you can write it as a small introduction in the first, then coming to the definition, that is, it is a sudden and rapid deterioration of the kidney functions that is resulting in the accumulation of lot of this nitrogenous waste products in the blood, as well as what is happening, it is also characterized by few things. So that is increase in the serum creatinine, that is a key marker of kidney function, and oliguria, where it is a decrease in urine output and often present in the acute kidney injury, though some forms of acute kidney can have a normal as well as a normal urine output. So this is a small definition. So if you are a by hearters, you can start from acute renal failure until this blood. So then think what is the next. So it is characterized by few things. So it is characterized by the increased serum creatine, as well as you can see oliguria is one of the thing. There's a chance of getting this fluid and electrolyte balances also. So due to the impaired filtration in the kidneys, so they will not be proper functioning. So that is acute renal failure or acute kidney injury. Then coming next to the renal failure, here you can write in exam, you can write in this kind of thing so that your examiner will get a little more attractive. And here you can see the symptoms. There is loss of appetite, shortness of breath, irregular heartbeat is also there, chest pain, then decreased urine output, edema. So edema is something swelling in the blood. So this is the symptoms, and this you can write in the format as mentioned before. You can write it in a mind map chart, or even you can draw all this kind of things. Don't waste your time, but if you're having time, make it in this beautiful manner wherein your scores is getting increased. Then the second, third, fourth and fifth, 6 points are listed here, wherein you can write it, you can give an explanation for this. So types of acute renal failure, clinical manifestation, that is something again related to the symptoms. Then diagnosis of acute renal failure, then what is the treatment that is given to acute renal failure, and nursing care in acute renal failure. So there is post-operative care as well as pre-op is also done. So we have to maintain all this as nurses. We have to take initiatives. So all these points must be written in your exam paper. So small gist is given like introduction. Then once after the disease condition of acute renal failure, you're writing the intro. You're giving a small definition for that. Once after definition, you can write the symptoms as mentioned. Then you can write what is this acute. So types are again, acute and chronic. Then coming to the clinical manifestation, that is something related with your symptoms. Diagnosis, what are the diagnostic things that they are doing. Then once after the treatment and nursing care, what is the role of the nurse in particular. So that you have to write the pre-op as well as the post-op. So this is all about this acute renal failure, or you can acute kidney injury. Then moving to what is this sickle cell anemia? So there's a proper definition. So it is a kind of genetic blood disorder that is production of abnormal hemoglobin. So there's a abnormal hemoglobin level, or hemoglobin is produced abnormally. So that is sickle cell anemia, wherein the sickling of cells is happening, and you can here also see the blood cells become sickle shaped, leading to the blockage of this blood. So there will be there's interruption in the blood flow, and there is no proper blood flow, as well as hemolysis is getting happen. So this is about the definition of sickle cell anemia. So there's even a picture representation wherein this is the normal hemoglobin. Here you can see the abnormal hemoglobin, and there is an obstruction of the blood flow also. Then coming to the pathophysiology and the causes. So pathophysiology, wherein the hemoglobin level is leading, or this thing is getting interrupted in the sickling of red blood cells under low level of oxygen. So the low level of oxygen is maintained. There is no proper oxygen supply is happening, and the sickle cells are usually very less. They are not very flexible. They cannot be easily bent, as well as they can block this blood vessels. This blood vessels is getting blocked because there is no proper blood flow, and it is causing painful crisis and having a shorter lifespan. So their days is from 10 to 20 days. Then coming to the causes. So causes is inherited in autosomal recessive pattern, and the person must always inherit 2 copies of sickle cell gene, that is from one form of each parent to have sickle cell anemia. So in that way it is getting caused, and sickle cell traits that is occurring only if one gene is inherited. So one gene is getting inherited, then only the sickle cell anemia is getting. So whenever you get a sickle cell anemia, you have to remember about a blood wherein there is a abnormal hemoglobin. So that should come in your mind in the beginning when you're reading or writing about sickle cell anemia. Then moving to appendicitis. So here in the picture only you can see wherein there is a inflammation. So this is something again related to this intestine, small intestine, large. So that's about that. And here the appendicitis symptoms are, you can feel fever. So that is a staple thing that is getting happen. So that's fever. You can see feeling of that pain, intense pain will be there, feeling ill, you will have continuous stomach pains over there, then loss of appetite, vomiting, diarrhea, nausea, increased urination and increased need to urination. So all these are kind of symptoms that is. So whenever you are reading, that is what, whenever you are imagining of a disease condition, so some pictorial representations can make you write this exam a little more clear. So that is why the pictures are given in front, so that you will understand the topic in detail. So moving forward, there are management of appendicitis. This is also important, certain questions that is coming to your exam. So please do refer this. So that is the conservative pre-surgical medication. So we tell it as preoperative care. So in that, so you have to see the IV fluids, pain management, antibiotics, whether NPO, that is nil per oral monitoring, and IV fluids wherein the hydration, it is to prevent dehydration, especially if the vomiting is present. Then electrolyte balance, correct any electrolyte imbalances are there. Pain management, in pain management, analgesics, that is example paracetamol or NSAIDs, that is non-inflammatory things to manage pain, and avoid strong narcotics that can mask the symptoms. And avoiding laxative. Why? Because we are avoiding these laxatives because they do not administer lactate, as they may worsen sometimes the symptoms if the perforation is occurring. So that is, we are just avoiding those lactatives. Then coming to the antibiotics, that is broad spectrum antibiotics, as well as we have to pre-op, we have to tell that is nil per oral, wherein nothing by mouth to prevent aspiration. During the surgery time, there must not be any perforation, that is some vomiting, there must be no proper, if there is the food intake, sometimes due to the sedatives, the medications that's given, sometimes the person may vomit it out. Then monitoring, so you have to monitor the vital signs, the temperature, heart rate must be on check, and SpO2 must be checked, so all these things. So then surgical management, appendectomy appendectomy is a kind of standard treatment that is usually given, that is laparoscopy appendectomy and open appendectomy is done. So usually all this is not a kind of serious disease condition, but we have to make, as a role of nurse, we have to make them understand what is this disease, what are the causes, what are the symptoms, what is the pre, what is the post management must be known to the people. Then coming to the post-operative care, so we have to have a check on the pain management, antibiotics, how is the wound, whether is it swollen or whether is it healing, or how is about the stitches, all those things must be taken care. Then monitoring and documentation. So as nurses, always remember that we have to document, we have to write it, we have to ensure that there's a regular monitoring of this vital signs, monitoring of the signs of infections, whether there's any phlebitis, there's any sepsis, infection. So all this must be having a check. Then what are their dietary patterns? So when this appendectomy is happening, some soft liquid diet must be given on the first days. Then gradually they can have their own regular diet, that is the fiber-rich, roughage and all can be taken up. Then coming to the mobilization part, encourage early ambulation, getting the patient up and getting up it in a moving condition. So that sometimes can lead up to deep vein thrombosis. That can cause, there will be a blood clot in the leg from your knee to till the ankle, and promote a better lung function. So a good lung function capacity also must be there. So we have to ensure that all these things are on a regular track and check. Then patient education. So we have to, as mentioned just before, we have to have a check, we have to teach them, we have to spread the knowledge. If a person is not knowing about appendectomy, as nurses, take initiative, give them a health education, give knowledge, spread knowledge to them. What is this appendectomy, to which age group it can occur, to what age it can occur, till what, why is it getting caused, what are the treatment, what is the pre-op, what is the post-op, in case if they want to know much more details. Then moving forward, the complications of appendicitis and their management, that is perforation, that is occurring if the appendix ruptures leading to peritonitis, that is infection of abdominal cavity, and it is requiring an immediate surgery through cleaning the abdominal cavity and no longer course of any antibiotics. Second point is abscess formation. So sometimes they might develop or gradually increase of the infection after perforation. So abscess drainage also must be taken care, wherein they may be needed and it will be followed up by the antibiotic therapy. Coming to the sepsis, a systemic infection that may occur with infection spreads from the appendix. So they have to have a check on that. Requires aggressive IV antibiotics. So IV fluid therapy must be going on, and fluid resuscitation, and also a close monitoring and intensive care unit settings if case it is necessary. Then coming to the infection at the surgical site, wherein it should managed with the antibiotics. In case if it is not happening, then they must have this monitoring of the signs of wound, dehiscence or any kind of infection. So is the pain score okay? That should be checked on with the nurses. So that is the main thing. Then the fifth one is the post-operative ileus. So delayed return of normal bowel function after the surgery. Then coming next to the tracheostomy. So we have discussed many things. Now we will again have a thing that okay, I have to study. But if you give some time, you're definitely going to score your desired marks and you are going to crack this. So coming back to the topic, that is tracheostomy here. So this images should come in your mind when you're writing this tracheostomy or acute renal failure, then coming to this appendicitis. So the pictures, so you will be able to write something in your papers. So coming back, a tracheostomy, it is a kind of surgical procedure wherein that is creating an opening in the trachea, that is the windpipe, and it is through the neck. It is providing an alternative airway of breathing, and the opening is it is called, or it is termed as stoma, and it is typically secured with the tracheostomy tube. So we are giving, so this is your tracheostomy tube, and that is moving through this windpipe. So that is the stoma we call. The opening is called stoma. And this tube is used when a person cannot breathe. So when the person is unable to breathe, we are giving this through the upper airways. So through the mouth and through the nose due to the obstruction, injury or illness. So this is a small or big definition of tracheostomy. So you can read it or you can understand it while you are giving much concentration on this topic. So it is not much burdenful, but take it in a lower pace and somehow try to manage up and score it. Okay, moving forward, the definitions and indications. So it is involving a surgical managementary methods. It is creating, as we mentioned, it is creating a trachea wherein there is an opening that is called the stoma, and here you can see it is inserted to facilitate the airway management. So what is the use of this tracheostomy tube is for the airway management. And the indications. What are the indications for this tracheostomy? So first one is the obstruction of the upper airways. Second one is prolonged mechanical ventilation, that is example in ICU patients with respiratory failure. So if the patient is unable to breathe or if they are having any lung infection or these kind of things, in those setups also this tracheostomy tubes can be used. Then chronic respiratory conditions and inability to clear this secretion. So this is all about the indications for tracheostomy. Then moving to the pre-procedure care, that is before tracheostomy, what you have to assess. So assessing the airway status, then reviewing the medical history. So in assessing the airway status, you are checking for the signs of any respiratory distress or any, how is their saturation level, that is the oxygen saturation level, that is in technically we tell, or in the clinical side you can see it as SpO2, and the need for any kind of ventilator support or respiratory supports, example this mechanical ventilation. Then reviewing this medical history, so they will be having sometimes any past medical history, so they might have been going through some traumas, neurological disorders also might be there. So that is why we are reviewing this medical history. Then prepare the patient. So definitely as nurses, they will have an anxiety about any procedure, whatever we are doing in hospital sector. So first point you have to write is explaining the procedure. So offer emotional support and explain the benefits of getting it treated. And informed consent. So there must be a particular person who is their bystanders, wherein they are giving a signature, they are giving a consent, so they are able to do or perform this surgery. Then pre-anesthetic assessment also must be done. If there is any general anesthesia required, so that also should be done by the procedure, so that you are ensuring that patient is having no objections for any of the procedures. Then pre-operative care, once after the operation, what you're doing? You're ensuring adequate oxygenation, then IV access also should be given. So that is the intravenous therapy also. The fluids must be ongoing so that the patient will get relieved or the pain will get reduced for some extent. Next one is the post-operative care management, airway management. In that, suctioning should be done. Then humidification, then assess for signs of any airway obstruction. So suctioning is done because any mucus, if it is there inside. So once after this operation, there's a hole given or hole is made done, so that there must be a suctioning. So with the suction tube, with some temperature or with some certain pressure, they are able to pull out this mucus. Then coming to humidification, so with the help of the tracheostomy itself, they are giving humidification so that so whenever you're getting cold, what is the thing you do? So we take the steam inhalation. So the same thing, that is only this humidification after the surgery must be taken care. Then assess for signs of any kind of obstruction, wherein their oxygen saturation must be checked. That is, their SpO2 level must be on a monitoring level. Coming to the wound care, you have to always inspect for the stoma, wherein check the tracheostomy site for the infection. If there is any redness, swelling or anything, must be informed to your concerned person. So that is about the inspecting of stoma. Then dress changing. So every day. So if you're going to clinical posting, definitely you will have an idea about all this. So once you're seeing this, definitely you can write also in your exam very well. Okay, coming back, dressing changing. On every day, basically there must be a changing in dress, because sometimes there might be bacteria, infection, sepsis, everything can happen. So on a safer side, you have to have a daily dressing, and the tracheostomy dressings also must be always changed. It should be cleaned, it should be very neat, so that must be ensured. Then tracheostomy tube care, so that is a very important thing. So we have to consider all the patients, like our own parents, our own relatives, so we have to give a very care. So as a part of your clinicals, you have to have some knowledge also. You have to have that emotional care and support to the patients. Let it be your theory part also, that should be written in your theory paper also. So regular clean the tube and change as per the hospital policy. So different hospital might have their own policies, so you have to follow the policies. Then monitor for any complications. Check whether any bleeding is there, infection, tracheal stenosis must be checked, and tube displacement. So all these things must be monitored and ensured. If you are not ensuring, complications can definitely happen. Then coming to the last point, that is the comfort and communication. You have to be well communicative. You have to express your feeling at the same way, so the patient also can reciprocate in that manner. So the pain management, speech. So speech, there will be other healthcare professionals wherein they are able to check, but as nurses, we also have to have a check or an eye on this kind of procedures. You're encouraging the use of speech valve or fenestrated tube, where the patient is alert as well as he's able to speak. That is monitored, that is being checked on. Okay, next is the pleural effusion. So don't get against tense, we'll make it up, okay? So this pleural effusion is, the definition is, it is an abnormal accumulation. So accumulation of what? Accumulation of the fluid in the pleural space. So there is a space between the two layers of pleura, which is surrounded in the lungs. So this pleural effusion, here you can see a diagrammatic representation where that is the trachea. This is a normal lung, and here you can see the collapsed lung, and this pleural space can also be observed wherein the air or fluid is in the pleural space. So this is a small definition about this pleural effusion, wherein it is the accumulation of fluid. In general, your main important key point is accumulation of the fluid. So that is about the pleural effusion you have to remember. Then coming to the types, so there are classification being done, that is transudative effusion, exudative effusion. So this transudative effusion is occurring due to the systematic conditions wherein after there is an altering on the fluid, that is having a heart failure, or sometimes even the cirrhosis also, that is even the heart cirrhosis can occur, wherein the fluid is typically clear and it is having low protein in that. Then exudative effusion, wherein it is occurring due to the local conditions such as infection, inflammation, malignancy, and here you can see a very high level of protein, and they may be sometimes appearing cloudy and bloody. So here in this, remember, rather than asking you types, they can ask you the differentiation between the transudative effusion and exudative effusion. So this is the difference between. So here you can see mainly it is occurring due to systemic condition, whereas exudative effusion, it is due to local conditions. Transudative effusion is occurring due to the alteration in the fluid present. This is due to, exudative is due to the infections, inflammation, as well as the malignancy. Here you can see it is clear, then low protein, but in exudative you can see high protein, as well as it will be cloudy and bloody. Coming to the next one, why is it getting caused, or what is this cause? That is the heart failure, pneumonia, malignancy. In heart failure, the most common cause of this transudative pleural effusion, pneumonia can cause due to this exudative pleural effusion. So you have to connect it with these points. Then malignancy, that is something related to cancer, lung cancer, breast cancer, and it is leading to pleural or metastasis. The next one is tuberculosis that can cause pleural effusion, particularly in some areas where there is high incident rate or the high incidence of tuberculosis. So that's about the pleural effusion types. Then coming to this chicken pox. So here again you think sometimes in AHN chicken pox is not much necessary, but that is also a question, or this is a disease condition. It is not only seen in your community health nursing, that can be asked in your AHN also. So chicken pox, it is also known as varicella, and it is highly contagious viral infection where it is caused by this varicella zoster virus, and which is a part of Heparis family. So here you can write the small introduction. Once after that, how is it getting affected? It is primarily getting affected in children, but it is also occurring even in the adults who have not previously had the infection or have not been vaccinated against it. So in that definition only, the whole simple points are very clear, wherein it can be affected mostly to the children. Sometimes it can even get affected to the adults who is not got chicken pox, and if chicken pox is also there, whoever is not vaccinated. So that is a small definition about chicken pox. Here you can see the picture representatives. Here the red spots also can be seen. So in this way we are identifying the chicken pox. And here you can see the symptoms, wherein extremely it is itchy, rashy, then swollen glands will be also there, and even here abdominal pain, headache, fever, all the kinds of basic symptoms will come, but itchiness, that rashes, everything is too much. So this is whole about some certain important topics that we have discussed. Hope you have understood the session. So we'll meet again with upcoming sessions, and important questions will be seen further. Until then, take care. All the best for your exams. Thank you all.